did want to get some additional experience and additional training. And so Georgia Southern provided that. My name is Enjoli Willis, and I received a Doctor of Public Health and Public Health Leadership from Georgia Southern University. Before I began my time at Georgia Southern, I was a public health advisor in the National Center for Injury Prevention and Control at CDC, and so I've continued to serve in that role post-graduation. I love being in the classroom. I love the debate. I love to learn. So I definitely enjoyed that part. I also enjoyed meeting new people. So I met some folks that worked at the same agency as me and who were really great colleagues and are still, we still collaborate and still are in touch today. But I've also met some folks that I wouldn't have, come across or run across in my professional career. And I've been super grateful just to have the opportunity to meet them and to learn about who they are and what they're passionate about, and hoping that, one day in the future we'll cross paths soon. So those are the things I've enjoyed while I was at Georgia Southern. There were a couple of courses that I really, really enjoyed, and it speaks to my interest, which I'm currently trying to transition to. The first was the ethics course that we had to take. It's always interesting to me as public health professionals. There are so many things that we have to consider when we're making decisions, and COVID is a perfect example of that. I kind of wish something like this was happening when we were in class, because it would have been a very rich discussion. But there's so many nuances to the decisions that we make, the policies that we put in place. And so that ethics course kind of navigated us through that. And it was quite interesting to hear perspectives from others and pros and cons about, the types of decisions we might make, whether, like, thinking about now in COVID-19, whether or not to mandate vaccinations or put policies in place that, limit movement to prevent the spread of infectious diseases. It's quite interesting to me, and I always see both sides of it. And I'm the person that likes to debate just for fun. So I enjoyed debating in that class a lot. The other one I enjoyed was our health policy course, and it's because of my interest in health policy. My current role at CDC, I work with funded recipients to support them and provide technical assistance around injury prevention topics. Some of that includes policy, but the bulk of it is geared and centered toward program implementation. And so my interest is in that area, and taking that class kind of let me pursue that interest. So those are my two favorite courses in the college. So being at Georgia Southern, I was pretty into my career. So not an early career professional, but I did want to get some additional experience and additional training. And so Georgia Southern provided that. And most of my experience had been in implementing programs, doing some evaluation, doing a lot of planning, a lot of partnership building, coalition building, and those types of things. This program allowed me to kind of stretch my skill set a little bit and get some more experience and knowledge around more research focused skills, which was super valuable for me in this program. The other thing that it allowed me to do is to build additional professional confidence. I feel like everybody goes through this phase where you're kind of questioning, like, am I supposed to be here? Like, I don't feel like I know a lot, or, you always know someone else who can do it better than you can do it. The program, the way that it's structured, the things that you have to do, the courses, the research, it puts you in that position to help you build confidence. Like, okay, these are things I was doing. Like I did this, I'm doing this now. This sounds just like work. Like I am doing this. So for me, it gave me additional professional confidence and to be able to navigate and pursue additional opportunities post graduation. There are a few pieces. I would say the best, going back to my comment about building confidence, is that, knowing that people can see the potential in me and getting the support, whether it's verbal or written, that, you got this. Like, these are things that you already do. It may be framed a little differently, or it may, be a stretch for you in terms of how you're doing it. But the encouragement and the thought that you have this, like, you're here for a reason. You didn't get here by chance. You were selected. You have the skill set. You have the knowledge. Just use it. You got it. So I think that was, I mean, it's not like academic, but that hearing that from different faculty and my my mentor was definitely helpful and reassuring at points when, you get to the lower points and it's like, why am I doing this? How did I get here? Getting that encouragement and getting that, you got this message definitely helped. That was probably the best piece of advice. The DRPH program, in terms of knowledge, like, I did gain some new knowledge, but a lot of the stuff that we've covered in the courses were things that I had been exposed to, whether it was through my MPH program or through professional experience. So content-wise, a lot of it wasn't new. But learning how to use the information differently or looking at it a little differently puts you in this space where it makes you uncomfortable. And so getting that feedback and getting that support and, the pat on the back, like, okay, this is great. Let's keep going. You got it. Definitely helped. By far the best piece of advice. Advice would be that your path is your path. It's very easy to compare, what you're doing with what another student is doing or what another colleague is doing. And in looking back at the experiences that I've had so far and the people that I've met and the places that I've been, no one else's journey looks like mine. And it's not supposed to. And as long as you're clear, if you're not clear, get clear. But if you're clear about, what you're passionate about, what you're interested in, what excites you, like the things that excite you, and you continue to pursue that, everything else falls into place. And it may not always be pretty. I know my journey hasn't always been pretty. It's been hiccups, it's been bumps, it's been, questioning God and the universe about, why things worked out the way that they do. But every time I look back on it, I'm like, it was supposed to happen that way because this is my journey. It's not my friends. It's not, my partners. It's mine. And so it has to look this way for me. And I think I'm now more recently comfortable with that idea. And it's taken a while, but everybody's journeys are different. Even if you end up in the same place, things happen the way they should for a reason. And it always, every time you look back on it, it's like, I see it. Like, that was amazing. It needed to happen that way, because if it didn't, I wouldn't be who I am. I wouldn't have the experiences that I've had. I wouldn't be able to share the knowledge that I can share had those things not worked out that way. So my advice would be, your path is your path and no one else's, and it's okay.